Let us talk about the disorder of suspiciousness, where people develop some kind of wrong belief and they stick to that belief no matter what. I'm Dr. Praveen Tripathi. I'm a consultant psychiatrist and sexual disorder specialist. I saw this patient a couple of months back. This 35-year-old gentleman came to my clinic. He was accompanied by his wife and mother. And we talked to the mother first and wife first, and they told me that he has started believing that wife is having an affair with somebody for last 2 years. And initially he would ask this question once in a while, and later on he became very insistent. He would say that you are having an affair and tell me what's going on. A wife tried explaining him that nothing of that sort is going on, but his behaviors increased. He would keep on checking her phone. He would keep on checking her WhatsApp messages. On occasions he would come back home early from office unannounced to see what is going on, and they started fighting. Patient's mother, who had accompanied him to the clinic, also tried telling the patient that nothing of this sort is going on, but the patient would just not listen. After talking to the family members, I interviewed the patient, and the patient was very nice. He was very polite. He greeted me, and he was dressed nicely. He was well kempt, and he was also working. He continued to hold his job, and he was doing pretty good in his office. So when I asked him what is going on, he very bluntly said that I'm perfectly fine. My family members are trying to prove that I'm crazy, but I'm not. I'm perfectly fine. On further prodding, he started, opening up, and he said that his wife is having an affair. I asked him with whom. He said there's this gentleman who lives right across the building in which they were living. The balconies of the two buildings were facing each other, and she was having an affair with him. So I asked him, have you seen them talking? Have you seen them together? He said, no, I haven't ever seen them discussing or talking ever. Then I asked him, have you seen them talking on phone, or have you got some message from that guy? He said that, well, he sends messages, but I haven't ever been able to catch it because he deletes it immediately. I asked her, have you seen her deleting messages? He said, no, she does that when I'm not at home, or she goes to some other room and then deletes it. I prodded him further that if you haven't ever seen them talking, if you haven't got any message, how do you really know? Finally, he said that sometimes when I go to the balcony, I see that guy standing over there, and just by the look at his face, I'm able to make out that there's something going on between him and my wife. And when I asked him that is not a good reason to believe that somebody is having an affair, and are you sure about it? He said he's completely sure about it, and there is not even an iota of doubt in his mind. This is how this suspiciousness manifests. People reach a conclusion on very flimsy ground, on grounds that are almost laughable. But for them, it is a very valid ground. And this is what is called as a delusion. So delusion is basically a belief which is wrong, but the person who holds that belief is completely convinced that that thing is true. And no matter how many arguments you make, no matter how many evidences you present to the person, he does not budge. He completely believes in that belief. So this is called as delusion, and in this patient's case, this would be called as delusion of infidelity. In this delusion, the person develops a belief that the partner is cheating on him or her. Now, in this case also, as the delusion progresses, it becomes more elaborate. For example, this patient had started believing that the mother is also helping the wife in continuing with the affair. He later on also started believing that sometimes kids are deliberately sent out of the house so that the affair can continue. By bits and pieces, the delusion elaborates. And sometimes it becomes dangerous. People sometimes become physically aggressive. There might be some physical violence also. There have been cases where the person hits the partner, or goes to that person with whom he is believing that the affair is going on, and hits that person. So it might be dangerous. In this case, the patient was not agreeing that he has any problem. We tried telling him, but of course, in delusion, the patient does not have any insight. A lack of insight means that the patient himself or herself does not recognize that there is a problem, and that is why it is so difficult to treat these patients. First of all, they don't agree to come to the clinic. They don't agree to meet the doctor. And when the doctor tells them that they have a problem, they don't agree with the doctor. Sometimes they start believing that the doctor is also a part of this big conspiracy going on. And even if they agree with the diagnosis, they refuse to take medication. In the case of this patient also, we tried our best. We tried telling him that this is going on, and it appears to be not true, and you take this medicine. Reluctantly he agreed. He took medicine for a month or 1.5 months, and he also started showing improvement. On the second or third visit when we inquired, the family members told that he continued to hold that belief that wife is having an affair, but he is not showing any aggression nowadays. The checking behavior has also gone down. He was looking more calm. But as it happens in some of these cases, after like 1.5 or 2 months, the patient stopped coming to the doctor. He stopped meeting the doctor, and probably he stopped the medications also. This is the problem. It is so difficult to convince the patient, and it is so difficult for them to make them continue on the treatment for a longer period of time. Now, the important thing to remember is that while it is difficult, but it's not impossible to treat the patient. There are many patients who, as they continue with the medication, they start developing insight. They start getting their insight back. They start realizing that there was something wrong with me, and if I continue with the medications, things would become better. There have been many success stories also. And it is important to make an effort by the family members as well as the doctor. So the reason why I'm telling you about this case history is that this is something which is quite common in the society, and people often miss this case because people have this belief that if somebody has a mental illness, the person should look like mentally ill. He should not be. He should be unkempt. He should not shave. He should not maintain himself. He should not be holding a job. But that is not always true. There are disorders where the person would look perfectly fine, but he has something going on at the thought level. So if you ever find somebody who's having similar symptoms in the family, in your friends, it is important to identify the symptom, take the patient to the doctor, take the patient to a psychiatrist, and get the treatment started as early as possible. Because with early treatment the results are better. And while sometimes it is difficult, the treatment continues for a long period of time. Sometimes patient refuses to take treatment, but persistence with the efforts usually bears fruit. So our effort is to bring such cases to you, to increase the awareness about the mental disorders, and we have been trying to do it for quite some time, and I hope that this effort bears some fruit. Thank you.